Hi, I'm Dr. Chan, and today I'm going to talk about premature ejaculation and give you 5 tips and tricks to try at home to help improve on your situation. Now, premature ejaculation is a very common thing that guys experience. In fact, almost 1 in 3 men experience this at some point in their lives. It's nothing to be embarrassed or ashamed about. The key feature of premature ejaculation is ejaculating sooner than you or your partner desires. Usually it's within a minute of penetration. First, let's watch this clip from one of my favorite movies of all time, American Pie, which addresses this issue of premature ejaculation in a lighthearted manner. Let's watch.
Oh yeah.
Here we go.
He's in, man. This just got a hell of a lot better.
Be gentle.
Okay.
Jim?
Oh no. Oh no. Oh no.
Oh no.
Houston, we have a problem.
Some of the causes of premature ejaculation are anxiety, which is probably what happened to our poor character Jim here, erectile dysfunction, psychological problems such as guilt or sexual abuse, and then finally sometimes relationship problems. Next, I'm going to give you 5 tips and tricks to try at home to help deal with your premature ejaculation. Tip number 1, masturbate an hour before you're planning to have intercourse. There's this thing in guys called the refractory period that after somebody orgasms, they can't get an erection or orgasm again during that period called the refractory period. In younger people, say like an 18-year-old, that refractory period might be as short as 15 minutes. And then in older people, like 70-year-olds, that might be as long as 20 hours. For our next trip, let's go over to Safeway and just kind of see what over-the-counter options that you can buy off the shelf. Tip number 2, use condoms. Now you probably know that condoms are something that will decrease your sensitivity. But what you may not know is that there's actually these special type of condoms that have a topical anesthetic on the inside of them. Tip number 3, if you don't like using condoms, there's a way to get the topical anesthetic without having to use it. You can buy this stuff over the counter or online. It's called lidocaine. What's really important is to just make sure that it's just lidocaine and doesn't have any other ingredients like menthol that might burn your penis. There's these icy hot formulations. These are not what you want to be putting on your penis. Normally, you want to put this stuff on about 30 minutes before you plan to have intercourse. Study has shown that it will increase the period before you ejaculate about 8 minutes, which is pretty good. Now, for those of you who are a little bit more spontaneous and find that 30 minutes might be a little bit too long to wait, there's also lidocaine sprays such as Promescent, which was developed by a urologist. This is the one that I usually recommend to most of my patients. You can apply this stuff on 10 minutes in advance instead of 30. So it's a little bit more spontaneous. One of the downsides of these topical anesthetics is that, especially with the creams, there's a chance that the stuff will transfer to your partner. And unfortunately, if that happens, that may cause their genitalia to go numb. So you want to be sure to kind of wipe this stuff off before intercourse. Tip number 4 is something called Kegel exercises. You may have heard this stuff from your partner or your mom when they talked about strengthening pelvic floors. So it's not just for urinary incontinence, but this will also actually help in terms of delaying ejaculation. Now, the key to finding the right muscles to contract are the next time you go to the bathroom and you're urinating, try to stop your stream and really focus on the muscles that you need to contract to stop it. Next, you want to start doing these exercises where you contract these muscles for 3 seconds and then relax them, and try to do it 10 times in a row, 3 times a day. You want to maintain your focus and focus on just tightening your pelvic floors. Be really careful not to be squeezing your abdomen, your thighs, or your buttock. Finally, for our last tip, tip number 5, this is called the pause squeeze technique. So you begin sexual activity as usual until you feel that you're almost close to ejaculating. And then at that point, you have your partner basically grab your penis near the glands and the shaft and squeeze really hard until the desire to ejaculate goes away. And then you do this as many times as needed. Over time, I think you'll eventually kind of train yourself to kind of automatically do this. So there you go. Those are your 5 tips. Give them a try. If they aren't enough, sometimes you may need to do something like medication. Some of the options that your physician or your urologist may be able to prescribe to you are something like Viagra if you have erectile dysfunction. Antidepressants like Paxil are really good at delaying ejaculation because that's one of their side effects, unfortunately. And then finally, tramadol, which is a pretty weak narcotic. This can also delay ejaculation as well as one of the side effects. Now, usually what I recommend to most of my guys is try the stuff that doesn't involve medications first, just because I'm always a little wary about putting people on brain-altering drugs like antidepressants or putting someone on opioids given the current opioid crisis in our country. Well, thanks for watching today. I hope you learned something and that you give one of these tips a try. Let me know down in the comment section below if you try one of these and it worked for you. Subscribe to my channel, and if you felt that this content was helpful, pass it along to your friends and family. Have an awesome rest of your day.